Hi everybody. My name is Katie. This is my YouTube video about my nursing philosophy. My nursing philosophy is probably very similar to other healthcare professionals and others in this class. Having a position or a philosophy is essential when we consider the way that we work in our professional setting. I believe that we are the gateway keepers of the healthcare. We're in high demand. We have a duty to do no harm to our patients and provide care to the best of our ability. While these statements can be vague and many ethical dilemmas, they can still help guide my practice as a nurse and as a future nurse practitioner. I don't believe that this is a career path chosen for the faint-hearted, as it can be pretty gruesome at times, tiring and emotionally exhausting, not to mention not always a clear path in regard to our decision making. One thing that I think about often before going to work is a commercial that I saw when I was in nursing school. I'm sure many of you have seen it. It involved many patients and family members throughout the hospital who are going through very different stages in their life. One person had a new baby while the other just received a terminal cancer diagnosis. So just those things to kind of think about before you go to work, that everybody is really going through their own issues. The commercial really touched my heart, and it really helped set my mind free of judgment and each and every day whenever I go to work, especially when I do find myself feeling a little bit judgmental, which I'm sure we can all relate to that. If I do have a difficult situation with a patient, I just reflect on that commercial. It just reinforces how we as nurses need to stop and show respect and dignity to all of those which we're in contact with. And not even just in the hospital, in everyday life. My state's Nurse Practice Act serves as my nursing Bible in a way, as it really helps guide my practice from a legal aspect. Combining the legal aspect and ethical dilemmas, distraught patients to newborn patients and dying patients, I really enjoy the problem solving in regard to how I can make the situation better for the ones that are here now in my care. For example, I'm a fairly new labor and delivery nurse, which I never expected to go that route. I'm really glad that I did. But I learned very quickly that people have very high expectations about what they want for their labor and their delivery. Therefore, I'm always there to inform my patient that this is their experience. I'm here to guide them, and will provide whatever I can to fulfill that experience. However, my first duty is safety for the mother and the fetus. I feel being open about that is appreciated and shows my patient that I am there for her and her family, and it's not about me pushing my beliefs onto them, but again, that I'm the gatekeeper for safety in this area, because in the end, we all really want the same result. And also just maintaining those personal and professional boundaries. I know many of my classmates have said over the years that their values and beliefs have changed with the experiences that they've had. I too fall into that category. I'm sure everybody in healthcare does, everybody in real life does. I feel that those experiences really shape us into the provider that we intend to be, by taking a problem and combining it with our personal values and beliefs, but also including the patient view in that mix. This is an ever-evolving process, and one that I'm excited to pursue as a nurse practitioner, and I'm really looking forward to this class. It really has helped me look back on other difficult situations that I've come across in my practice, and really helped me just think through that and think about what I would have done differently, because it's really not always clear. So this is really great to just bring up those situations and really think about what we do, what our personal beliefs are. So I've really enjoyed it so far. All right, I'm looking forward to the class.